No, it's not started. You can go. यार तुमको नोट करा
Good afternoon, everyone present here. I am Disha P from BCom second year. It is pride with a great pride and joy. I take this opportunity to welcome the assembly. Honorable dignitaries, most valued teachers, and all the audience, it is my honor to introduce the resource person for the event First Aid Awareness Program. Dr. Gopinath Desi Sir, physician emergency care trainer and also a first aid trainer. Dr. Desi Sir has completed his PG in Symbiosis International University, Pune. He has worked in America Heart Association, Neurocritical Care Society, and many more places. He is also a member of Red Cross in Bangalore, an active participant of Parliamentary Forum on HIV, AIDS, UNAIDS, and NACO, New Delhi. We welcome you, sir. If you know, please take a pen and paper to note down the points. Thank you.
It's my great privilege to be here, respected faculties, BMS College of Commerce and Management, and dear students. So today, you are all gathered here to learn the basic life support. Most commonly, the term is similarized with first aid. Yes or no? So what do you mean by basic life support? I'll start with the question. What do you mean by basic life support? Or you can say first aid. Whenever there is, exactly, it is an immediate care to a victim or a patient. Okay. Whenever there is a life-threatening condition, say for example, accident, bleeding, breathing difficulty, chest pain, asthma attack, fits, snake bite, accidents, what are all the emergencies which can danger to the life? Or many a times it can lead to a long-term complications. In that situation, before the actual help arrives, that means what is the actual help? The hospital or the medical facility or an ambulance or the expert medical team arrives. What are the best possible thing you can do it or you can help to improve the chances of survival is nothing but basic life support. It has got a very wider definition. That means whenever you come across an emergency situation, whenever there is a risk to the life, for example, life-threatening conditions, in that situations, till the ambulance arrives or till the expert medical help arrives, you have to keep him alive by doing a basic life support that will start with compressions, airway, and breathing. It is most commonly we call it as CPR. All of you are aware? Okay. So okay. Before starting the basic life support program, you need to understand the chain of survival. This is very, very important. Okay. So now, whenever there is an emergency, don't assume that emergencies will happen only in hospital. No. Emergencies can happen in your house. Emergencies can happen in the auditorium. Emergencies can happen in the working place. Emergencies can happen in the roadside. Only thing is we need to prepare to provide the basic life support or first aid. Okay. So why this chain of survival is very, very important when it comes to basic life support? Because whenever there is an emergency, you have to call for an ambulance. So in Indian scenario, we call for 108. Okay. Whenever there is an emergency, we need to call for a help. So either you can call for a help or you can call for 108. And what is the next step here? Very good. This is called as a hand symbol, that is called as compressions. Why compression is required? Because you take any emergency, whether it is bleeding, breathing difficulty, head injury, poisoning, snake bite, what are all the emergencies you take, ultimately, if you don't treat them immediately, it will end up in cardiorespiratory arrest. What do you mean by cardiac arrest? I'll make it very simplified in your this thing. What do you mean by cardiac arrest? In general terms. Heart attack. Very good. When there is no heartbeat, so heart stops functioning, that is called as cardiac arrest. What do you mean by respiratory arrest? Almost similar. What do you mean by respiratory arrest? Arrest is what? Absence. So absence of breathing. See, these are all the two very vital signs of life. All of you agree? If person is not having pulse and not breathing, that means he is in cardiorespiratory arrest. So for cardiorespiratory arrest, what is the line of treatment? Someone collapses in front of you in an unresponsive state with no pulse and no breathing. The immediate line of treatment we call it as CPR. What is CPR? Cardiopulmonary resuscitation. What do you mean by cardio? Heart. Pulmonary means lungs. Pulmonary means lungs. Resuscitation is you are trying to revive the person. I'll just quote few legendary persons who suffers a sudden cardiac arrest because of lack of CPR or lack of cardiopulmonary resuscitation on the stage or on the spot. They have died before reaching the hospital. Our APJ Abdul Kalam. He was just delivering a lecture in IIT seminar hall. He was just delivering a lecture. He don't have any warning symptoms. Suddenly he collapsed. Before shifting the hospital, he died. And the most recent incident, KK was performing on the stage in Kolkata. He just experienced breathlessness. Yes or no? Before reaching the hospital, he died. And also, our legendary star, Puneet Rajkumar, went to the clinic or hospital with a history of chest pain. Before reaching the hospital, he died. Why? Why it's happening? If you take the global statistics, in Indian scenario, the highest rate of death is sudden cardiac arrest. Next comes to your accidents. Next comes to your poisoning. Next comes to your snake bite and all. So the number one killer all over the world is cardiovascular diseases. They are cardiac arrest and stroke. Why it is very important to train you people in basic life support? Because in our country, now with a population of more than 150 crores, emergency strikes anywhere. We can't predict the emergencies. So all the time, the doctors, nurses and ambulance may not be present. At least the bystander person, if he is trained in CPR, he can make the difference between life and death. That is the motto of training a general population, particularly college students, school students in first aid training program. See, what will happen in sudden cardiac arrest? We don't know the cause of why it has happened. There are many causes for it. We don't know, probably the massive heart attack or a sudden blood loss or a severe head injury or a thoracic trauma. You have seen, no, in many times in football matches and all, suddenly the players collide each other, a blunt injury to the chest, they will collapse on the ground and they will die. You will hear many news. Why? The moment heart suddenly stops, perfusion to the brain, that means the blood supply to the brain stops immediately. In that situation, the CPR, the compression is the life-saving method. So that is the reason in basic life support, we always concentrate on high quality compressions. That is called as chest compressions. Whenever you come across a situation where person is not having pulse and no breathing, what it condition called? All of you should answer. If there is no pulse and no breathing, what is this condition called? Cardiorespiratory arrest. So what do you mean by cardiac arrest? There is the absence of pulse, absence of heartbeat. What do you mean by respiratory arrest? Absence of breathing. If person is unresponsive, that means he is not responding to your commands. If you check the response of the person, suppose if you check the response, hello sir, hello madam, hello, he is unresponsive with no pulse and no breathing, that means this person is in which condition? Cardiorespiratory arrest, where every second matters. Every second is very, very important, because the moment you stop compression, brain will not get a oxygenated blood. Suppose brain doesn't get the oxygenated blood supply, what will happen? Person is not going to survive. That is very, very important. Okay. So what is the chain of survival? Yeah, the previous slide. Okay. This is the symbol of compressions. Whenever you come across a situation, you need to recognize this cardiac arrest or respiratory arrest. You need to call for EMS. What do you mean by EMS? Emergency medical system. That basically in Indian scenario we call 108 ambulance. Okay. So we have to call for EMS. That is basically we call it as 108 ambulance. Early CPR. What do you mean by CPR? Cardiopulmonary resuscitation. That means literally you are compressing the heart. That means it should pump the blood to the brain and rest of the organs. Okay. What is this symbol called? Anybody? What is this symbol? Very good. It is a power symbol. Correct. It is a shock or something called as a electric voltage symbol. Why this symbol is given here? See, if someone suffers a cardiac arrest, sudden cardiac arrest, many a times heart will be in vibrating state. In which state? Vibration. This is called as fibrillation. This is called as fibrillation. If heart is beating like this, fibrillating like this, it will not pump the blood. And the moment heart starts fibrillating like this, person usually collapses on the ground. In that situation, doing compression will pump the blood to the brain and rest of the organs, and giving shock will stop that fibrillation. You have seen defibrillation in many movies and serials. They will give the shock. Why? Because most of the sudden cardiac arrest victim will be in condition called ventricular fibrillation. This is the most deadliest rhythm. Okay. See, any person who is complaining of chest pain, sweating, breathlessness, and he is facing difficulty in walking, what do you suspect? What do you suspect? See, one person, okay, take for example, don't assume that emergencies will happen only in the hospital. Emergencies can happen anywhere. Okay, any person or in your working place or in your college, if someone is complaining of chest pain, profusely was sweating, struggling to breathe, and is unable to walk, what is this condition called? Very good. You suspect it as heart attack. Yes or no? See, what will happen in heart attack? There will be a blockage in the vessels which are supplying to the heart are blocked. Do you think all heart attack patients will die immediately? No. But in sudden cardiac arrest, every second is important. In sudden cardiac arrest, someone collapses in front of you in an unconscious state where each and every second decides life and death. That is the reason this cardiac arrest and heart attack are totally different. They are not same. You got the point? Heart attack is a circulatory problem. Circulatory problem in the sense there is a blockage in the vessels which are supplying to the heart. What about cardiac arrest? It's an electrical event. So suddenly heart will start vibrating. It will happen in many situations. For example, there is a massive heart attack or head injuries, lot of blood loss due to the accident, and poisoning, not stress. Stress will not cause sudden cardiac arrest. These are all the leading cause. Yeah, of course, stress can cause. Okay. So these are all the leading cause for sudden cardiac arrest. a massive head injuries, thoracic traumas, road traveling accidents, lot of blood loss, all those things will trigger the heart and it will start vibrating. The moment heart starts vibrating, person is not going to survive. If he receives early CPR within few minutes and early shock within few minutes, then the chances of survival is 90%. The moment you delayed compressions, you are not given shock, then the chances of survival will start reducing. That is the reason we are telling, whenever there is a sudden cardiac arrest, topmost hospital is not the option and top doctor in the city is not the option. It is the you who stands next to the patient. Probably that person is your family member also. We don't know. If you know how to perform CPR till you get the ambulance, you are going to keep him alive. You are going to succeed. Doesn't mean that all CPR received patients is going to survive, but 90% of the patients will be saved. That is the reason we organize this program in your college. At least you should get oriented with basic life support. Okay. So I hope you got the message. Okay. Right. So what is this symbol? Shock. Now you may ask one question, sir. If someone suffers a cardiac arrest, say for example in my house only, if anybody suffers a cardiac arrest, where will get this device to shock? You may ask one question, yes or no? Until you get the AED device. The AED device is available in all 108 ambulance. You know that thing? All 108 ambulance has got a AED device. Until you get the ambulance, until you get the AED, what you need to perform? To keep him perfused to the brain, you have to compress the chest until you get the ambulance. See, one person can't do more than 2 minutes. Easily you can call for another person. You just rotate, keep doing compressions until you get the ambulance. Once ambulance is arrived, get the AED, you attach the AED, and if it is really shockable rhythm, AED will give advice to shock. That will be demonstrated in the practicals. You hear about the AED also. So this is how the chain of link runs. Now you tell me, in our day-to-day scenarios, whether we are concentrated on these things. See, we are only in the situation of shift the patient. You just call the ambulance, shift to the hospital. But when you shift the patient to hospital, we all need is a pulse. We all need is breathing. Okay, the moment you wasted 10-15 minutes, the vital time in shifting the patient, and they will end up in hospital or in casualty, even the best care, medical care will ended up with brain damage. And the person will be lifelong in coma stage. Why? Because the initial treatment is the foundation. You got the point? Basic life support is the foundation for all your ventilators, cath labs, everything will run only with you. If you don't perform CPR, you tell me now, if there is no pulse and no breathing, do you think the person is alive? You don't have any signs of life. So to get a pulse, to get a breathing back, what you need to perform? CPR. To do CPR, you doesn't require any high-end medicines. You doesn't require any high-end instruments. All you need is your hands. That is the reason we call it as a basic life support. You got the point? Okay. And this is what? Anybody? Very good. It is called as an ECG rhythm. We have shown an organized rhythm here. That means there is a pulse. With all your measures, we got a pulse. That means person is saved. Now you tell me, so we can save thousands of life by performing high quality CPR on the ground. This doesn't require any high-end instrument. You can perform CPR in the BMS college auditorium also. You got the point? Okay, next slide. Just to remember the basic life support, CAB, that is called as CAB. What is CAB? Chest compression, airway, breathing. Okay, whenever you come across a situation where there is no pulse and no breathing, you need to start CPR. The sequence is CAB. What is C stands for? Compressions, A stands for airway, and B stands for breathing. The step number 1 in basic life support, assume that if someone collapsed in front of you, Assume that if someone collapsed in the auditorium, take for example, any of your colleague who is working with you, suddenly he collapsed in front of you. What is the first thing you need to do is make sure that scene should be, that is very, very important. What is the first thing? Make sure that scene must be safe for you as well as the victim. Once scene is safe, you need to assess the patient by checking the response of the patient, that is tapping both the shoulders. Hello sir, hello, are you okay? Are you okay? If he is unresponsive, immediately you should call for a help. Somebody help and call the ambulance, get AED. And you should give the location. Where exactly the location? You should give BMS College of Commerce, 4th floor auditorium. The location is very, very important. Yes or no? What is the next step you need to do? Check the pulse. So how long will check the pulse? In adults, we check the carotid pulse. Yeah, once you call the ambulance, next slide. Yeah, you need to check the carotid pulse. How to check the pulse? Take your 2 fingers, locate your windpipe, that is your trachea. Just feel the Adam's apple. We call it as Adam's apple. You have heard this thyroid cartilage? Just slide it for 2-3 centimeters. You will feel the pulse. How long you should check the pulse? Spend at least 5 seconds, not more than 10 seconds. Okay, within 10 seconds, if there is no pulse, what you need to do? You need to start CPR. That is called as chest compressions. How to do compressions? All of you stretch your hands. All of you stretch your hands. Keep your shoulder, elbow and wrist should be in a straight line. It should be in a straight line. So only the heel of the hand, should touch the center of the chest. Got the point? It should touch the center of the chest. Where to place the hand? You have to keep your hand exactly on the center of the chest. Why you should keep on the center of the chest? Why can't on the left side or right side? See, why you should keep exactly on the center of the chest? This is a breastbone or sternum. It is very strong bone. And the chances of rib fractures are less. If you keep your hand on the left side or on the right side, what will happen? Ribs will get fractured. Yes or no? So that is the reason it is always to keep your hands exactly on the center of the chest. Once you start compression, what will happen? The heart will pump the blood. The moment you compress the heart, it will pump the blood. So where it will pump? It will pump to the brain and rest of the organs. So the perfusion is very, very important to ensure the proper functioning of the other systems. So what will happen if you don't compress properly? Brain will suffer, say, hypoxic damage. Have you heard the word hypoxia? What will happen in hypoxia? Brain dead. So person will be in vegetative state or in coma state. Okay. Slide. Okay. I said it is CAB. Chest compression, airway, breathing. Okay. C is for compressions. You need to deliver compression 100 to 120 per minute. What is the rate of compressions you are going to deliver? 100 to 120 compressions per minute. That is very, very important. And you have to place your hand exactly on the center of the chest, and you need to compress at least 2 inches depth. How much depth you need to compress? At least 2 inches. Then only you are able to pump the blood, perfuse the blood. So it will be like this. Okay. So it is 100 to 120 compression. That is your C. What is the next thing? Is airway. In unconscious patient, tongue is the most common foreign body which obstruct the airway. So it will block the airway. So in that situation, what we need to do? We have to open the airway by placing one hand over the forehead and 2 fingers over the chin. So this makes the airway open. So that is the reason we always recommend in unconscious patient, you should not give anything orally. The most common mistake what people will do is, in unconscious victim, they will try to pour the water. If they pour the water in an unconscious victim, it will go to the lungs. If it goes to the lungs, he will aspirate and he will die. So don't ever give anything orally in case of unconscious patient. Okay, in unconscious patient, the tongue is the most foreign body which blocks the airway. That is very, very important. Okay, so what do you mean by airway? We have to open the airway by head tilt, chin lift. Many a times we will not do this method whenever there is a head injury. You got the point. Whenever there is a head injury, first we'll stabilize the cervical spine, we'll put a collar. You have seen many trauma patients, how they will shift? They will put a cervical collar, they use the stretcher in an ambulance. Yes or no? And while doing CPR only, they will shift the patient. Yes or no? So whenever you suspect head injury, that time you should avoid this head tilt, chin lift method. Okay. And what is the next thing? Is to give breaths. Why you should give breath? Because there is a respiratory arrest. Respiratory arrest, breathing is stopped. That time you have to give a manual breaths. What are all the things you are doing is artificial. Because person is not having pulse. Person is not breathing on his own. What are all the things you are doing? That is called as your manual compressions and breathing. Okay. Next slide. Okay. How long we need to continue? How long we need to continue? If I ask one person to do CPR for 5 minutes, 10 minutes, is it possible? No. One person can perform maximum 2 minutes CPR. I don't want to recommend more than 2 minutes. Why? Because the quality of compressions will come down. So one person is doing CPR for 2 minutes. After 2 minutes only you go for a pulse check. It doesn't mean that you are doing some 30 compressions and going for pulse check. No. Only after 2 minutes you go for a pulse check. So how many compressions we need to deliver? 100 to 120 compressions per minute. That is the rate of compressions. And the ratio is 30 compressions to ventilations. What is that ventilation? Is the breathing. Because we are dealing with cardio respiratory arrest. We have to take care of cardio, that means heart, as well as breathing also. Okay. So what is ratio here? 30 compressions, 2 breaths. In 2 minutes, we need to deliver how many cycles? 5 cycles, and you have to continue it for at least 2 minutes. Then only you should check for a pulse. Next slide. This is the very simplified algorithm. You visit any hospital in Bangalore, particularly any corporate or major hospital or medical college or in a BMS hospital, you will find this algorithm in the casualty. Why they have kept in this algorithm in the casualty? Because this is the one guidelines which follow everywhere. It is applicable to you or even for doctors. That means whenever you come across an unresponsive patient, what kind of patient? What kind of patient? Unresponsive. That means you check the response of the person, he is unresponsive. And no breathing. That means no breathing or no abnormal breathing. You need to call for, what is this symbol? What is this symbol? You have to call for a help or you need to call for an ambulance. And if there is no pulse and no breathing, you need to start CPR. If there is a pulse and breathing, are you going to start CPR? If there is a pulse and breathing, are you going to start CPR? No. Suppose this person is unresponsive, having pulse and breathing. Do you require CPR? No. So in that situation, what you need to do? He is unresponsive. We don't know the reason, whether he has got snake bite or any poisoning or any post-ictal state of fits. Probably he started some seizures, and once seizure subsides, he become unconscious. In that situation, don't give anything orally. He is unresponsive, but having pulse and breathing. In that situation, we need to turn the person to a left lateral position. This is called as recovery position. Why we should keep him in left lateral position? One is the airway will be patent, and even though if he vomits, the vomit will come out. Or if there is a saliva, it will come out. He will not aspirate. So you have to keep him in a left lateral position until you get the ambulance. You have to be with the patient. Every 2 minutes, keep checking for a pulse. Suppose after 2 minutes, there is absence of pulse. Then what you need to start? Very good. You need to start CPR. What is the sequence of CPR? C, A, B. Chest compression, airway, breathing. And one is called D, that is called as to deliver shock. That is called as defibrillation. Okay. What is this symbol called?
What is this symbol? Defibrillator. So where will get the defibrillator? Defibrillator is available everywhere. In ambulance it is available. Where else you find this defibrillator? Yeah, in hospitals and all it is quite common. Where else apart from hospitals? Very good. It is available in airport, metro stations, Orion Mall, and many major corporates. Why they will kept AED? Why they have kept AED? See, these emergencies we can't predict where it will happen. Don't assume that emergencies will happen only in casualty, only in ICU, and they will give prior warning. Tomorrow there is going to be a cardiac event in your house. You better shift the patient to hospital. No, emergency strikes anywhere. Only you have to be prepared. That is the reason all these AEDs they have kept in general public places, so that at least any one trained person like you. Yes or no? You are not confident, huh? Yes, if you are available on the spot, at least you can use that device to save somebody's life. And we don't know that person may be your family member, your close friend. So we can't predict emergencies. Emergencies can strike anywhere. Okay, right. This is a simplified algorithm. And here, a point of remembering is push hard and push fast. What do you mean by push hard and push fast? Push fast is 100 to 120 compressions per minute, and push hard is at least 2 inches depth you need to compress. That is very, very important. Of course, it varies with child and infant, because in child we will not give the same depth compression. In child, at least we give nearly 5 centimeters, and in small infants we give nearly 4 centimeters. Most common cause of sudden cardiac arrest in adults is cardiac events, whether it is heart attack or arrhythmia or stroke. But in pediatric cases, we see very less incidence of heart attacks. Yes or no? In pediatric, the most common cause is respiratory arrest. That is the reason we always teach you CPR, compression, airway, breathing. If there is a pulse, what is the next thing you need to take care? Airway and breathing. Hope you got the point. Okay? Yes. Now, I will just demonstrate. If there is a cardiac arrest victim here, I'll just demonstrate, then I'll call you people to perform the CPR. Okay. Assume that an elderly man walking in front of you in the BMS college, suddenly he collapsed in an unresponsive state. What is the first thing you need to do? Look for scene safety. So why you need to look for scene safety? Suppose this person is collapsed in the middle of the road. He collapsed in the middle of the road. So you are trained in CPR. It doesn't mean that you will directly jump into the middle of the road and do the CPR. You will become a second victim. Yes or no? Scene safety is very, very important. Why? It is not risking your life. You are helping someone. That doesn't mean that you should risk your life. Yes or no? What you need to do? First thing is make sure that scene should be safe. Scene should be safe from the moving vehicles. Scene should be safe from any hazardous objects. What are the hazardous objects? Broken glass pieces, electrical wires, chemical spillage, burns. Yes or no? Or some gas leakage, fire. So make sure that scene is safe. Once scene is safe, check the response of the person. That is very, very important. How to check the response? Tapping both the shoulders. Hello, sir. Hello. Are you okay? Are you okay? He is unresponsive. Immediately you should call for a help. Hello, sir. Yeah. What's your name? Your name? Suprit. Please call 108 ambulance and ask them to get the AED or stretcher. Okay. And immediately what you need to do? What you need to do? He is unresponsive. You have called for a help. We don't know the reason for unresponsiveness. Whether he is poisoning or alcohol, we don't know. But he is unresponsive. Now, what is the next step? Check the pulse. While checking the pulse, same time look for breathing. How you assess breathing? A visible chest rise and fall. Okay. If there is no pulse and no breathing, immediately you need to start CPR. What is the ratio? I said 30 compressions to ventilation at a rate of 100 to 120 compressions. And we need to start compressions within 10 seconds of the assessment. So how to start? You need to keep your hand exactly in the center of the chest. That too, only your heel should touch the hand. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 30 compressions, and you need to open the airway. Keep one hand over the forehead 2 fingers over the chin. Okay. So now I will not advise you to give mouth to mouth breathe. Why? No, it is not because of COVID. We don't know this person. Suppose this person is your family member, you will not hesitate to give mouth to mouth breathe. No. Saving life is important, no? You have seen in many drowning patient. Yes or no? Or sudden cardiac arrest. You have seen some heartwarming scenes in the COVID situation. Because we are shortage of oxygen, in times of India, there was one photo. The mother who is giving mouth to mouth to his son. Have you seen that? You have not seen. During the time of COVID, because of the oxygen supply is not there, beds are not getting, mother tried to resuscitate his son because probably he is the sole blood earner. You have seen in the news and all. Yes or no? See, your exhaled breath contains 16% of oxygen that could be life-saving for your, you are not doctors, for your family members. Forget about patients. Cardiac arrest can happen in your house also. Yes or no? That is the reason India is the highest place where you are losing patient on the road. Probably your family member will complaining of chest pain and all. What you will do? You will call for an ambulance and he will collapse in the bathroom itself. None of you knows that how to do CPR. You will become panic. You will start rubbing his hands. That will not save life. Performing CPR, performing compressions, that saves life. That is the reason basic life support is the core syllabus from 7th standard onwards in UK. From which standard? Hope you got the message. Okay. This is from 7th standard onwards. A 7th standard students know what is AED. If I show this device, he will say this is AED and he know how to operate this machine. Unfortunately, in Asian countries, we are lacking of emergency medicine because we are not, again, ICU doctor will take care. Casualty doctor will take care. Jaydeva will take care. Jaydeva will take care only if there is a pulse and breathing. To get that pulse and breathing, you have to start CPR from your house. That is the core concept of this program. That is the reason we are losing thousands of life. It is not for only legendary persons. It can happen to a common man like you and me all. Okay. So what is this device called? I hope I want little concentration from you people. I think you are 3rd year, right? Yeah. 2nd year. So what is this device called? This is called as automated external defibrillator. And this device you have seen in many airports, all domestic airports, metro stations, bus stands, everywhere they have kept. Why? Because we can't predict the emergencies. And this device is very easy to use. Okay. And this device doesn't require any medical knowledge. You don't need to go to a medical school to operate this machine. Only thing is you need to follow the steps. There are 4 steps to operate the machine. The step number 1 is to power on the machine. Once you power on the machine, the next step will be advised by AED. What it advised? First step is to on the AED. Once you on the AED, the next will be advised by AED itself.
Applying pads to patient's bare chest. Plug in pads connector next to flashing light.
So we need to attach the AED pads. So these are the AED pads. And for a common man, they don't know where to attach. That is the reason there will be a markings here. So one pad on the right side, just below the right collarbone, and another pad on the left side, just below the nipple. So you just need to plug in.
Analyzing heart rhythm.
What it's saying? Do not touch the patient.
Shock advised. Charging. Staying clear of the patient.
So nobody should touch the patient.
Deliver shock now.
So all clear. I am going to give shock on 3. 1, 2, 3.
Shock delivered. Start CPR.
What it advises? Start CPR. That means you have to continue with the CPR. See, this device is very simplified device and it is life-saving. It can be used anywhere, not only in the hospital, outside the hospital also. There are 4 steps to operate the machine. Step number 1, you need to power on the AED. Step number 2, you need to attach the pads. Where to attach the pads? I think last row people. One pad on the right side, just below the right collarbone. That is your right collar. Another pad on the left side, just below the nipple. Once you attach the pads, you need to plug into the AED. The moment you plug into the AED will take few seconds. It will not take more than 10 seconds. Why? If you delay more than 10 seconds, brain will suffer a hypoxic injury. That is the reason it is designed in such a way that it will not take more than 5 to 10 seconds to analyze the rhythm, and it will advise shock only if it is required. When AED advises shock, that means heart is vibrating. Suppose AED doesn't advise shock, that means that rhythm doesn't require any shock. And if there is a pulse, AED will not give shock. You got the point. If there is a pulse, AED will not deliver shock. And this AED can be used even in the public places. That is the reason AED is kept in all airports, malls, metro stations, and in railway stations, because we can't predict where the emergencies can strike. I hope you got the little orientation with the AED. So what is this device name? Automated external defibrillator, AED. Now you may ask one question, sir, you said basic life support is all about our hands and breath, but you are saying this device. Yes, this device is designed for a public people. Till this time, I have not used any drugs. I have not used any ventilator. I have not used any high-end instrument to save someone's life. Just with your hands, your breaths, and use of AED will save somebody's life. Think it's clear? Yeah. We'll call for the practice, the students. Okay. Yeah. Anybody voluntarily can come? No. 1 second. Or all of you, would you like to practice? Okay. Yes, guys, come. Yeah, one more person can come. Come in the second row. Okay. Yeah, any person. One more person. Okay, your good name?
Suprit, sir.
Okay, Suprit is walking in the corridor. He noticed that suddenly a middle-aged person started complaining of breathlessness. That means breathing difficulty, and he just collapsed in front of the Suprit. Yes, Suprit, what is the first thing you do? Very good. First thing is to call for a help. Okay, before that?
Make a scene safer.
Okay, make sure that scene is safe. Very good.
Then, hello, ma'am. Hello.
Very good. Check the response.
Please respond. Please respond.
He's doing good. Check the response.
Check the response. You don't
Yeah.
have response.
He's not responding.
You check the breath.
Yeah, before that, you need to call for an ambulance. That is very important. Okay. Yes.
Ma'am is doing.
Yeah.
Check the pulse. Okay, I'll check the pulse.
At least 5 seconds, not more than 10 seconds. Very good.
There's pulse or if there
At the same time, look for breathing, whether person is breathing or not. Okay. Yeah. If there is no pulse and no breathing, what you need to start?
compression.
CPR. That is called as CAB. Chest compression, airway, breathing. Until you get the
AED.
AED. Very good. Okay. Yes. Go ahead, Suprit. Good. Little slow. Little slower. Little slow. Yeah. Good. Good. Yeah. Exactly in the center of the chest. See, he delivered 30 compressions. He delivered 30 compressions, but suddenly you went to for a pulse check. No, you should not do this mistake. Only after 2 minutes, you should go for pulse check. Why you should not go for frequent pulse check? The moment you go for frequent pulse check, the compressions will be delayed. That means the brain will get less oxygenated blood. Okay. Yes. One more cycle. Then you have to open the airway. Keep one hand over the forehead, 2 fingers over the chin. Okay. This will make the airway open. Okay. Yes. Okay. One more cycle. Keep it hand straight. Yes. Good. Very good. Little slow. Little slow. Yeah. Little slower. Yeah. The depth is correct. Little slow. Yes. Very good. So you need to keep your hand exactly in the center of the chest. Okay. Yes. Good. Okay. Yes. Next person. Come. Hey, come. See, the previous batch, we have done it for, we have done mandatory to all the get. Okay, you come. Two of you can come. Yes, come, sir. Last. Come, I will help you out. Don't worry. Come fast. No, don't waste the time. It is because I am running short of the time, because in one day it is very difficult to teach. Yes, come. Good. Yeah, from last row, 2 persons. Yeah, come. Come, sir. Please come. Yes. Okay. Now assume that a person met with a road traveling accident. In the middle of the road, a young fellow in the middle of the road, a young fellow met with an accident and he was just lying unconscious. What is the first thing you do? The person collapsed in the middle of the road, met with a road traveling accident. What is the first thing you do? So in the middle of the road, there are a lot of vehicles are moving. Yeah, you have to call for a help. That means you need to call somebody's help. Call any of your friends, they will come or not. You call any of your friends, whether they will save this person's life or not. Yes, come. Come, one of you to come. 1 or 2 people can come. Okay. No, you are done already. You can send one more person. Okay. Come first. See, it involves involvement. See, it involves your involvement because you are going to be a what? Lifesavers. Okay, now, what's your name? Vinod. Vinod called for a help because he predicted that there is an emergency. Because the person is lying middle of the road, it is not safe to resuscitate on the middle of the road because there are a lot of moving vehicles. If you not take the proper precautions, what will happen? There is already one patient, you will end up with 2 patients. Yes or no? So you have to take for help. Okay, now they will stop the moving vehicles and they will bring the person to a safer side. Okay, now you assess the person. Now scene is safe. Say loudly, scene is safe. Very good. Say loudly. All of you should hear. Okay, very good. Now, what is the next thing you do? Very good. You will call for the ambulance. Now, check the response. Check both the shoulder. You should tap. Yes. Tap both the shoulders. He is responding to your commands. Now, check the pulse. There is a pulse. Students, all of you listen. There is a pulse. Yeah, there is a pulse. You felt that there is a pulse. Yeah, and he is breathing also. He is unconscious. What do you need to do? You will not give CPR. See, why I give this scenario? In Indian scenarios, they will try to pour the water in an unconscious patient. You should never ever do that. Particularly, it will happen in road trauma patient. They met with an head injury. They will be found unconscious. They will try to open the mouth and pour the water. The moment they pour the water, it will go to the lungs. And it is life-threatening. In unconscious patient, you should not give anything orally. This is the take-home message. If you suspect any head injury, leave the person like that if he is in a safer place and try to hold the head. Don't move the head because your all respiratory center, your heart center, everything is located in the brainstem. That is the reason young victims, they will die on spot because of brainstem injuries. You have seen, no, in the news and all, you will hear all these stunts and other things without wearing helmets. Why we advise us to wear helmets? Because the moment you end up with a brainstem injury, the topmost surgeon will not save you. Once brainstem is gone, everything is gone. That is the reason we always recommend you people to wear the helmet and also strap the belt. That is not very, very important. It is not simply wearing helmet to escape the fine. In Indian scenario, every year more than 8 lakh, I'm telling 8 lakhs, people of young victims, they will die because of road traveling accidents. And all these are youngsters. Particularly the age group is 18 to 35 years. Not because of wearing proper Safety measures. Your fractures, your injuries, your rib fracture, your leg fracture, everything can be fixed, not your brain. You got the point? See, you can start the heart also by doing compressions. But once brain is damaged, it's a irreversible damage. That is the reason it is always important to stabilize the spine. Ask the ambulance to come immediately. Get the stretcher. Put a cervical collar. Keep the person in a stretcher. Every 2 minutes, keep checking for a pulse. At any point of time, if there is no pulse, what you need to do? CPR. Okay, now Vinod, right? Yeah, he stabilized this person. He called for an ambulance. Ambulance is arrived. Now he requested for a collar. What is that called? Cervical collar. He applied the cervical collar. He asked one person to stabilize the spine. Yeah, hold the spine. Cervical spine like this. Yeah. Okay. Now, yeah, you are not supposed to do this method. Okay. You ask them, hold this like this. Now the ambulance is arrived. Okay. So ask few more people to help, and all of you should turn the person to one side. Keep the stretcher here. Shift the person in a stretcher. Put the straps, belts, put him on oxygen, and now you shift the patient. Then only he can be saved. Suppose if you not follow these steps, he met with an head injury, you shifted randomly in a auto or four-wheeler, then what will happen? Even though if he survives, he will be in a quadriplegic state, paralyzed state, because his brainstem is damaged, and lifelong he will be in a bedridden state. So that is the reason it is very, very important, because you are going to be responsible citizens also, as well as a lifesavers also. It is your responsibility to teach the crowd, sir, don't give anything orally because he is unconscious. Anything if you give to the orally, it will go to the lungs. And if it goes to the lungs, what will happen? He will aspirate and he will die. And not to raise the head. If the person is having pulse and breathing, be with the patient, ask the ambulance to come, shift in a stretcher. This is for all accident patients, those who are unresponsive. You got the point? Okay. Now, after 2 minutes, you check the pulse. There is no pulse and no breathing. What is the next thing you are going to do? Yeah, start doing CPR. Yes, go ahead. Very good. Push hard. Meanwhile, there are 3 members are there. One person can grab the AED from the ambulance and keep the AED next to the patient. You keep doing CPR. Don't stop the CPR. And he can on the AED. Yes or no? Yes. Once you on the AED, AED will guide you the next steps. So you need to attach. Don't stop the CPR. So attach one pad on the right side and one on the left side while doing CPR itself. Okay, now he has become tired. Request one more person to do the CPR. Yes. And you need to plug in. Now do not touch the patient. Okay, not to touch the patient. What it says? That means heart is fibrillating in nature. So it is charging. Stay clear the patient. Nobody should touch the patient. Okay. All clear. I am going to give shock on 3. 1, 2, 3. And begin CPR. Yes, start CPR. Yeah, if you follow these steps, see, for this, you doesn't require a hospital. You doesn't require a medical doctor to come all the time. You can do it on your own. If you train, don't stop CPR, he is not going to survive. Okay, now he is tired. If he is tired, he can request another persons to do CPR. Yeah, you can change. Probably, if this could have done to APJ Abdul Kalam or KK or Puneet, probably they could have survived. Forget about all this. Probably any of your family members, those who lost your parents or your grandparents with a cardiac arrest, you could have saved your. Okay. See, this AED is available in every ambulance, but people don't know how to use it. And this doesn't require a medical school knowledge. Okay, don't stop. He will not survive. Keep doing. Okay, 2 persons can come. Come. Yes, madam, please come. Both of you come. No, you only. Please come. Come fast. Yeah, please. Now it will give some confidence to you people. Yes or no? Yes, come. Now CPR is in progress. Yeah, you can stand here also. You can do it from here. You can do it from here. Yes. Do it. Okay. He is tired. Take over the CPR. Yes. Keep your hands straight. Keep your hands straight. Yes. Very good. Good. If you become very tired, you can request one more person to do the CPR. Yeah. See, you can do it CPR either on the right side or on the left side. It doesn't mean that you should stand only on the right side. No. Okay. Yes. Push hard, madam. Remove the watch. Yeah, you can just remove your watch. See, every 2 minutes, AED will start analyzing rhythm and it will give you the advice. Now 2 minutes is not over. We have done many interruptions. We'll see whether this person is going to save or not. Push hard. Yeah.
Do not touch the patient. No shock advised.
What it says? No shock advised. Start CPR. Push hard, push hard. Yeah. Okay, 2 minutes over. Somebody check the pulse. Now they will say pulse is there, sir. Pulse is there? Is there? Good. You know, claps at least. Okay. So that means person is saved. This can be done, no? When you can do it on the mannequin in BMS auditorium, you can do it in anywhere. That is the reason AED is kept in all place, but the person should know how to use it. That is very important. Okay. Yes. Good job. Okay. Nice. Good job. Okay. Hope it is not boring session for you people. Not boring. Very boring. Okay. Okay. Now I will play 2 videos regarding this sequence are concerned. You will understand why learning basic life support is very, very important. Okay. I think it's visible to all. Is it visible to all? Okay.
Can you help me call the ambulance?
Right away in the business district. Please, yes, someone has just collapsed.
Can you get an AED, please?
Excuse me. Wait. Excuse me, sorry, excuse me.
clothing from the patient's chest. Peel one place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient.
Okay, guys, stand clear, guys.
Analyzing. Shock advised. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
Sure, you okay?
What happened?
We found him collapsed, so we did CPR, and I gave him one shot from the AED. Now he's been much better.
Okay, I'll take over.
Don't worry, you will be fine. We will send you to the nearest hospital, okay?
Is this scenario? Airport.
At US Soccer, keeping our players, coaches, and referees safe is our highest priority. Cardiac arrest is the leading cause of death in the United States, and while it may not be that common on the pitch, it's an emergency you should be prepared for. This training may be the difference in saving the life of one of your players, teammates, coach, or referee.
Hey, D! D! You okay? You okay, coach?
D, are you okay? Can you hear me? Adam, call 911.
Okay.
D, Nate, go get the AED. D, roll you over. D.
Hello? We're at Olympic Park. My teammate just collapsed and we're performing CPR. Okay, thank you.
Kevin, come here. Put your hands right there in the center of his chest. Push hard and fast, 100 beats per minute.
Call for medical assistance. Remove clothing from patient's chest to expose bare skin.
Go, begin again.
Pull green tab to
going, hard and
remove
fast.
pads. Peel pads from liner. Apply pads to patient's bare chest as shown in picture. Press pads firmly to patient's bare skin. Assessing heart rhythm. Do not touch the patient. Stand clear of patient. Shock advised. Press the orange shock button now.
D, you alright?
He just collapsed. We started CPR. We used an AED. He's shocked him once. He just started to come back, and his name's D.
Great job, Coach. Come here. D, are you awake? You hear me? What's your name?
If someone has a non-contact collapse or a player is struck directly in the chest and immediately collapses, presume that it is a cardiac emergency. Immediately begin hands-only CPR while someone else calls 911 and gets an AED. For each minute that goes by, there is a 10% decrease in the victim's chance of survival. Be calm, act fast, and act as a team. Push hard and fast, 100 times per minute, across the middle of the victim's chest. Do not stop to give breaths. Place the AED pads as shown and directed by the AED device. Then continue performing compressions as directed. The AED will instruct you on how to deliver a shot. no matter whether you're a coach, referee, player, or parent.
Thank you for taking part. Lend your hands and save a life.
Switch off. On the lights. See, in the scenario, you have observed both the scenario, they are not given breaths. Yes or no? Why? The priority is compressions. That is the reason C stands first. C, A, B. Chest compression, airway, breathing. Suppose I don't know the victim. See, that person is unknown. We don't know what kind of disease he is suffering. Probably some of the diseases will spread from saliva. So I don't want to risk myself giving breaths. So what I need to do is, I need to continue with CPR. So what is the rate of compressions now? Anybody? Very good. It is 100 to 120 compressions. Many a times in your first aid box, okay, you have this mask called pocket mask. If you are familiar with the first aid box, then there will be a mask called pocket mask. So whenever you come across a situation where the person is not breathing, you need to place this mask. This narrow portion is to the bridge of the nose and this wider portion is to the mouth. So you need to place the mask like this, deliver 30 compressions, okay, like 1, 2, 3, 4, 5, 30 compressions. Open the airway by doing head tilt, chin lift method, seal the mask properly and give one breath for 1 second and one breath for 1 second. Look for chest rise. If there is a chest rise, that indicates your breathing efforts are normal. In a drowning patient, drowning, submerged in water, in drowning patient, many a times these lifeguards, they used to carry this pocket mask in their belt. Why? Because the moment you come across a drowning patient, they will drag to the safer place. What they will do? They will open the airway and they will give breaths so that his ventilation should be ensured. In spite of that, they are not responding. Immediately what they will do? They will start CPR. You got the point? So whenever you have a pocket mask option, you can use this pocket mask, and this is called as bag mask device. I think in many ambulance, in movies and all, you have seen this device. This is called as a bag mask device. So to use the bag mask device, at least 2 persons is required because 1 person can't use the bag mask. See, I am doing CPR here. Okay, I can't come to the head end side to deliver the bag mask, because to deliver bag mask, person should be always on the head end side of the patient. So there is a technique called EC technique. What is the technique called? EC. E is nothing but your capital E, and C is to seal the mask. Okay, you just keep this narrow portion towards the bridge of the nose and wider portion to the mouth. Make a C, ABC to seal the mask, and E is to lift the chin and deliver 1 breath, 1 second, 1 breath, 1 second. And another person can do CPR. With these measures, you are going to save somebody's life. You take any emergency. Okay. What are all the life-threatening emergency situation where you face electric shock, poisoning, head injury, fall from height, snake bite, yes or no, breathing difficulty, hypotension or shock, all those things will lead to cardiorespiratory arrest. That is the reason whenever you recognize any emergency, we have to treat. So prevention of arrest is very, very important. The moment you come across a situation where the person is complaining of chest pain, he is struggling to breathe, immediately you should call for an ambulance. Start him on an oxygen. Shift to the person nearest to the hospital where we can prevent cardiac arrest. That is very, very important. Okay, see all these first aid things, you know, whether it starts from dressings or bleeding stoppage or fracture management, or someone collapsed in the middle of the road with both the bone fractures. So you'll ask the first aid kit. So you'll just put some dressings, you stop the bleeding. So all those things are what? Prevention of arrest. Because if you leave the person like that, he starts bleeding continuously from the fractured site. So probably if you lose 3 to 4 liters of blood, what will happen? The BP will falls. And if the BP falls, suddenly heart will start vibrating and they will end up with a cardiac arrest. That condition is called as hemorrhage. because of hemorrhage. They will die because of hemorrhage, because of massive bleeding. Being a first aid provider, always you should remember, you should call for ambulance, because ambulance has got all the equipments. Starts from AED, stretcher, cervical collar, and the bleeding stoppage tools. What are those tools? Easily we can wear the gloves, take the pads, you put it on the bleeding site, put the tight bandage, or if there is a fracture, there will be a splint. You know, there will be a splint, something called as a wooden plate kind of things. You can keep the wooden plates or some splints, put the dressing, stabilize this fracture, and ship the person to a hospital. That will be prevented further damage to the bone. That will prevent blood loss. That is very, very important. So now you come to know that in any unconscious patient, you are not supposed to give anything orally. Suppose person is having pulse and breathing, you have to turn the person to a left lateral position. And where else will come across this situation? Particularly fits, seizures. Suddenly they will throw a seizures. In seizures, don't ever give this iron rods, coins to the patient hands. It will not stop the seizures. There is no scientific evidence. In seizures, only thing is ensure patient should not have the head injury, because suddenly they will fall, they will end up with a head injury. Make sure that they are lying in a comfortable position. Switch on the fan, open the windows, keep them laying in a comfortable position, and once the fit stops, you turn the person to a left lateral position so that the saliva, or if they vomit also, it will come out. It will not aspirate, and immediately you should call for ambulance and ship the patient. Okay, hope it is clear. Okay, any doubts in this? Any doubts? It's a voluntary call. 3 members from this side, girls or boys, whoever, yes, please come. 3 members, you can come. Yeah, you only, madam. 1, 2, 3, yes, come. Come first, all of you come. Okay, from here, 3 members. Any 3 members? Come. Okay. Yeah, only you can start the CPR. Okay, right. So now you got a call from the neighbor saying that a 60-year-old person collapsed in the bathroom in an unconscious state. They know that in BMS they organized one first aid training program. Somehow they come to know that you are trained in first aid. Anyhow, this guy is going to help. So your neighbor called you. Now please come, sir. My grandfather is collapsed in the bathroom. Yes. What is the first thing you do?
Relocate the body.
Body, don't call it the body. Okay. Yeah. Okay. Person. Okay. First thing is you check the safety. So he collapsed in the bathroom. Do you think bathroom is a safe place to do? No. So what you need to do is, very good, you bring the person to a safer place. Yes. What is the next thing you do? Very good. You check the response. He is unresponsive. Yeah, he is unresponsive. What is the next thing? No, he is unresponsive. What is the next thing you do? Before that?
Call for help.
No, you should call for what? Ambulance, because it is outside the hospital. The moment you come to know that he is unresponsive, you tell, what's your name? Anamitra, to call the 108 ambulance and give the location, whether it is Girinagar or Srinagar, wherever. Okay, you give the location. Okay, now you check the pulse. Is there any pulse? No pulse. Whether he is breathing? No. So he is having no pulse and no breathing. Assume that he is in a cardiac arrest state. So what is the next thing you do? Go ahead. Keep it exactly in the center of the chest. Very good. Yes. Push hard. Keep your hand straight. Very good. Yes. Push hard. No need. Leave it. No, no need. Leave it. Push hard. Good. Push hard. Push hard. Keep your hand straight. Hand straight. Yes. Very good. 1, 2, 3, 4, 5. Don't lift the hand. You keep the hand there only. Yes. 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. So once you do the 30 compressions, what I will do is, don't leave the hands. Keep the hands there only. So I will give 2 breaths. 1, 2. Okay. Again you start compression. Do it. So he become tired. He can switch the roles. Okay. Yeah.
Check for an AED.
Okay. Now the ambulance is arrived. Ambulance is next to the gate, outside the gate. See, ambulance will not come to your place, right? We have to go to the ambulance and grab the AED. So now he grabbed the AED and come to the spot. Okay. Now AED is arrived. What is the first step in AED? Very good. Yeah. What is the first step in AED? What is the first step?
So turn the machine.
Turn on. Keep on the machine. On the machine.
Plug in pads connector next to flashing light. Apply pads. Plug in connector.
This is on the left side.
No, so this side here.
Apply pads. Plug in connector.
Yeah. Okay. Yeah. Now we have to plug it.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging.
Give a warning before.
Stay clear of the patient.
Say all clear.
All
Deliver shock now. Press the orange button now. Shock delivered.
Yes, sir.
Start CPR.
How long we need to continue? Till you get the expert person from the ambulance to take over the person. See, this can be done in your house also. Yes or no? Okay. He's become tired. He can take over the patient. Okay. Yes or no? Okay. Yes. Good job. Okay. Good. Big round of applause for him. Okay. Next. Anybody from this side? So, a 20-25-year-old person experiencing giddiness suddenly collapsed on the ground. Experiencing giddiness. Okay, suddenly he collapsed on the ground. What is the first thing you do, madam? He collapsed on the ground. Okay, first thing is scene safety. Very good. You will call for an ambulance. What is the next thing? Check the response. That is important. Okay. Yes. Yeah. Check the response of the person. He is not responding. Okay. Check the pulse. There is a pulse. There is a pulse. Pulse is there. Breathing is also there. What is the next thing you do? Okay. One is we have to keep him in the left lateral position or recovery position. Or you feel that sudden this person is not had any breakfast or because of the dehydration, he collapsed. That means what you need to do is you need to elevate the lips. You have to raise the legs. It is quite commonly happens many times in hospital. They will take the injections and after the pain, they will feel like syncopated. So what you need to do in that condition,
Don't rub the hands and feet. That will not give it there. You assume that because of the low blood pressure, the person is fall on the ground. You just elevate the legs, both the legs, for at least 30 to 50 seconds. If you elevate the legs like this, the blood flow will go to the heart and BP. It's quite common, no? Morning, if you skip the breakfast and you attended some NSS camps and all, you will also feel giddy and fall. Yeah. In that situation, what you need to do? You just elevate the limbs, both the legs for a few minutes, and observe the patient response. Suppose patient felt very comfortable, very much comfortable and better, you ask him to sit the patient comfortably, give him some water to drink. It doesn't mean that a conscious person is asking for water. No, our doctor has told not to use it. Don't say like. We say only an unconscious patient is not doing that. If a conscious person is asking for water, please give. Okay. It doesn't mean that you should not give water to any trauma patient. Okay. Yes. Okay. Now, after 2 minutes, check the pulse. Now there is no pulse. There is no pulse. Okay. Very good. So you have to start CPR. So once you start CPR, you have to keep your hands like this. It should be interlocked each other. Okay. So only your heel should touch the center of the chest. Okay. Very good. Keep your hands straight, madam. Yes. Good. Suppose you got a AED here. In your campus, there is a AED. Okay. You keep doing CPR. Don't stop. Okay. Now AED is there. What is the first step in AED, madam? What is the first step? You have to on the AED. Yes. On the machine. On the machine. Yes. Now AED is on. You need to follow the AED guidelines. One pad on the right side. Yes, that is on the left side, just below the nipple. Another pad on the right side. Keep doing CPR. Reverse, reverse. Very good. Plug in connector. Do not touch the patient. This time you can switch the roles. Suppose she become tired. Now this is the time you can switch. Say loudly, all clear. Otherwise, if somebody touching the table, they will also get electric shock. So you will get more number of casualties. Yes or no? Yes or no? Okay. Yes. Yeah. Sorry. Now, if anybody touching the table, if you're not giving any warning before delivering shock, you will get more number of casualties. You got the point? Yes. So it is an electric shock what we are giving. If someone is touching the person, he will also get electric shock. Okay. Yes. CPR. Now you can change the role. Okay. Yes. So how long you need to continue CPR? Until you get a signs of life. That means patient started moving or having pulse or started breathing, showing signs of life. Or you get an ambulance or some expert team is arrived to take care of the person. Okay. Yes. Good job. Okay, madam. Done. Okay. Apart from this, few other emergency topics which are very essential and life-saving are electric shock injuries. So whenever you suspect electric shock injuries, the higher voltage joule shocks, particularly this high tension wires, the small electric shock injury is not life-threatening, particularly when there is a construction work is going on, a lot of electric activities are going on. So the most highest risk is arrhythmias. Suddenly, if the person get an electric shock, why they will die? Because heart usually start vibrating. In that situation, first thing is switch off the mains, bring the person to a safer side, start immediate CPR and use AED as much as possible. Because in electric shock, heart is an organized organ, requires an organized electrical supply. Suppose if there is an abrupt supply of this thing, suddenly it will start vibrating. So the moment it starts vibration, it will call as fibrillation. So in that situation, the treatment is CPR and shock. That is called as defibrillator. Okay. Next most common emergencies we face is poisoning. So poisoning, don't think that only through mouth. No, poisoning can happen through nose
eyes, skin, and through IV injection or through oral route. Anything which causes harm to the body is poison. So don't give any home remedies. You have to ship the person immediately to hospital, whether it is snake bite or insecticide poison or sleeping pills tablet poison or whatever it may be, probably a suicidal attempt. So don't ever treat in your house. So always call the ambulance, shift the patient to a hospital, because that requires a definitive treatment, because we don't know, this poisoning patient suddenly may deteriorate after 2-3 days and they will die. This is very, very important. Electric shock injury is also very, very important. Don't ever neglect an electric shock circuit patient. Initially, they may look normal, but suddenly they will have cardiac arrest. So that is the reason it is always better to call emergency whenever you suspect a life-threatening emergencies. Okay, right. Hope we'll conclude, madam. Yeah. If you have, I'll give you 10 minutes time. If you have any doubts or any questions, you can ask. Any questions in cardiac arrest, respiratory arrest, and AED? I hope at least you got some orientation about what is AED and why we should use the AED device. Okay. Yeah. Yes. Anything else? Have you heard the word choking? What do you mean by choking? If there is a foreign body airway obstruction, your endoscopy and bronchoscopy will be available in the hospital. But by the time you shift the person to hospital, he will die in the middle of the road. So how to relieve choking? No, how to relieve choking? That is called as, anybody who attended first aid training? Yeah, come, please come, sir. Come. Suppose, so if there is a foreign body here, we ask the person to encourage him to cough, because cough is the protective reflex which can remove the foreign body. You ask him to cough. Suppose he is unable to cough, then it will be very difficult for him to maintain the airway. So most of the times what will happen? This is called the universal choking spot. If anybody grabs his neck like this, it is a choking spot. So he is unable to cough. In that situation, what we need to do is to ask him to bend it forward. So this can be done even in the restaurant, because by the time you shift the person, the airway is blocked. So what we need to do, we need to stand behind the person, ask him to bend it forward. We have to give an inward and upward thrust. What we need to give? Inward and upward thrust. So grab the person and you have to give inward and upward thrust. So don't try in a conscious person, because they will vomit. Okay, what are the things we had in the afternoon, it will come out. Okay, so it will discard the foreign body. Okay, at any point of time, if the choking person become unresponsive, what do you need to do? CPR. Very good. Okay. Yeah, yes. You have any doubts? He asked some doubt. Yes.
How do we get to know if it is left side or right side? Is it the AED pad?
Yeah. That is the reason I told. No, it is already marked in the AED itself. For the common man, where to attach, there will be a markings here. If you look at the pads here, see where to attach, they are giving the markings. You can see here, one on the right side, one on the left side, there will be a marking. So this is basically designed for a common man only. This is not designed for hospital use. Usually it will be kept in public place only. Okay, it's a good question. See, it will be marked in the pad system itself, where to attach. Suppose if you attach wrongly, AED will not detect. It will say, check the pads. It is very smart device, smarter than you. Yes or no? See, every 2 minutes it will analyze, and it will not take more than 10 seconds to check the pulse. It is a programmed device. That is the reason it is confidently we have kept in the public place, so any person can use. You got the point? Okay. Yes, madam.
Thank you so much, sir, for addressing the gathering. Thank you, everyone. Thank you. You may leave now.